The disease known as a plague has been stalking humanity for over 5,000 years, and there have been many outbreaks. In fact, there have been 3 pandemics caused by the Bacillus bacterium. The first was in the 6th century. It devastated the Byzantine Empire and was known as the Plague of Justinian. The third began in China in the mid-19th century and quickly spread throughout the world. But it's the plague that began in 1346, which killed more than 15 million people in just 7 years, that we refer to as the Black Death. The Middle Ages was a time of superstition, religious fanaticism, and ignorance, and so they thought it was the end of the world. In reality, it was just the largest pandemic in the history of humanity. Welcome to Medieval Madness.
In October of 1347, 12 ships dropped anchor at a Sicilian port. Those who eagerly approached were met with a grisly sight. Almost all aboard were either dead or barely alive, their skin erupting with blackened boils that dripped pus and blood. In horror, the Sicilian authorities demanded that the ships set sail. But though they left, the damage had already been done. The Black Death was now in Europe, and millions would die in what is considered one of the greatest disasters in history. Europe was hit hard by the plague, but it was not hit first. Before the infested ships arrived in Sicily, rumors of a frightful sickness devastating the populations of China, India, Egypt, Persia, and Syria had spread far and wide. While no one knew what caused it, it seemed to follow the trade routes spanning the Near and Far East. When it appeared, it was by all accounts unstoppable. Those struck by the Black Death would begin to swell at the lymph nodes in their groin or underarm regions. The growths would soon develop into large blackish blue, egg-sized lumps, or for the even less fortunate, expand to the size of apples. These would then fester and ooze various bodily fluids. Beyond this, the victims could develop a combination of additional symptoms, including fever, pain, chills, sweating, upset stomach, and diarrhea, which was almost always followed by death. According to those who observed it effects firsthand, it appeared that the brief physical contact with the sick person's clothing was enough to pass on the disease. The most prevalent theory is that Black Death began when rats with the plague died, and their fleas then sought blood from another readily available source, humans. Ships during the mid-1300s were commonly infested with these rodents. Following the death ship's arrival in Sicily, the plague continued to spread, following a trade route pattern to other port locations throughout Europe and North Africa. However, most recently, this rat-based theory has been questioned. Later outbreaks of the plague followed a different pattern entirely, and historical records of the Black Death make no mention of a mass rat die-off preceding it. Now, some scientists suggest that human fleas and lice were the true culprits. In this model, fleas would bite infected people and then move on to others in the nearby vicinity. Mathematical simulations show that a human flea model more closely matches the data from 7 of 9 plague-hit European cities than a rat flea model does. At this point in our history, the real methods of disease transmission were not yet understood. Without understanding it, most were helpless to defend against it. Few areas other than some islands cut off from the rest of Europe made it through the pandemic plague-free. The bacterium infiltrated virtually every European city's defenses, and many who appeared perfectly healthy one day could be dead in a few days. It was uncommon, though possible, for someone to survive a week or two before succumbing. Compounding the problem, those with the disease would typically be normal for the first few days, making successful isolation all but impossible. Those who tried to protect themselves by fleeing to the country were not safe there either. The plague decimated livestock as well, and countless pigs, cows, chickens, goats, and sheep also died brutal deaths, leading to a shortage of wool throughout the entire continent. While many European areas had a death rate of around 30%, the Italian city of Florence lost 90% of its population. Sometimes bodies of the deceased remained where they had died, as there were not enough living people to bury them. The Black Death may not have been causing the devastation all by itself. When victims' bodies were exhumed from mass graves in England, anthrax spores were also discovered. If anthrax was occurring at the same time,
This would have made things much worse, as it can be passed by mere skin contact. It's possible that anthrax and other diseases made people more susceptible to the plague due to compromised immunity, or that the body count attributed to the Black Death included victims who actually died from other illnesses. Beyond its quick transfer and the contributions of other diseases, the way the Black Death was treated failed to help and may have spread it further. Medical practitioners would perform bloodletting, cutting into veins to correct the supposed imbalance of blood. This procedure was ineffective and dangerous. Boil lancing was another technique, where the boils were punctured to drain the contents. While the buildup of pus could be poisonous, popping them could also lead to death from toxic shock, and the contents of the boils were highly contagious, likely spreading the disease even more. Other methods, such as burning herbs or immersing the sick in vinegar, were also unsurprisingly ineffective. Eventually, many doctors stopped accepting patients, and priests refused to perform last rites, all in an attempt at self-preservation. The post-impact of the Black Death brought significant transformations across Europe that extended far beyond the immediate loss of life. The drastic reduction in population created a severe labor shortage, which in turn shifted the balance of power between landowners and workers. Wages increased, working conditions gradually improved, and the rigid feudal system that had dominated the medieval society began to weaken. Economically, the decline in population led to changes in land use, with less productive farmland abandoned and more efficient agricultural practices emerging. Urban centers, though initially devastated, eventually became the hubs of recovery, trade, and innovation. This period saw the beginnings of social mobility and the early development of a more market-based society. The demographic collapse also influenced advancements in public health and sanitation. Authorities began to recognize the importance of hygiene, quarantine measures, and organized response to disease outbreaks, setting precedents for modern health systems. Culturally and intellectually, the Black Death encouraged a renewed focus on science, medicine, and human resilience. These developments gradually contributed to a broader societal progress in the centuries that followed. In summary, while the Black Death was one of the most catastrophic events in the human history, its long-term effects helped shape the European society, fostering economic reform, social evolution, and advancements that had defined a new era.